prevalence of heart disease has increased. Number of cath labs started coming in Faridabad. My cath lab started in 2002. That time we used to do around 17 angioplasties in a month. Now we are doing around 150 angioplasties a month. Along with the angioplasties, almost many other procedures which can be done on cath lab like ASD closure, PDA closure, then dilatation of the mitral valve, aortic valve, pulmonary valve, then replacement of the aortic valve percutaneously. Then along with that, electrophysiological studies and radiofrequency ablations. On this cath lab which we have, flat panel cath labs, neurointerventions and peripheral interventions are also being done. Over a period of say around 25 years, we have seen a sea change. Now in the city of Faridabad, there are 10 cath labs. And there are, at that time in 94, I was the only cardiologist in the whole state of Haryana, but now there are about 15 to 20 cardiologists in the city of Faridabad alone. So the time has changed, the prevalence of disease has changed, and the awareness in the public has also changed. People want proper treatment. They are coming forward whenever there is so much of awareness that whenever the patient gets chest pain, they directly come to the cardiologist most of the time, because they now know the difference between a qualified specialist and the general doctor. 2002 we started angioplasty program on round the clock on 24 hours basis, and patients were coming and the angioplasty was being done within half an hour to 1 hour of patient arriving in the emergency. About 7-8 months back we bought G cath lab, Optima IGS 320, and my experience with this cath lab has been really good, because this cath lab has got a feature of stent wedge, and this stent wedge has got a additional facility of wire subtraction. The image quality is really good. This stent can be seen very, very clearly, and we can see which part of the stent is not fully expanded. And after subtraction of the wire, even we can see two stents, overlapping stents, which is particularly a useful feature for bifurcation lesions. And also the stent expansion can be very clearly seen. Omega 4 table is also very big, long table. This table helps us in doing peripheral interventions. During peripheral interventions, it is, we can keep the patient on either side. Sometimes we have to reverse the patient. We don't have to keep shifting the patient up and down when the table is long. The other thing is that this machine has got a fluorostore capability. The fluoroscopic images can be stored, and the most beautiful part of fluorostore is that the resolution of the image is so good that in a thin patient you can do the entire angiography on the fluoroscopy. So the radiation dose on fluoroscopy is almost 10 times less than the cine. So whenever the patient is thin, you can do on fluoro, or otherwise also when we are doing angioplasty of complex lesions like chronic total occlusions, that radiation dose is a area of major concern, and we do most of the steps during angioplasty can be done on fluoroscopic imaging, and those can be stored also. So that way you can save lot of, you can avoid cine, and you can save on the dose, which helps, which not only protects you as a doctor, but also gives lot of protection to your patient in a long procedures. There is another feature. There is a switch where you can reduce the radiation dose. There is a switch available on the machine. That switch, if you press, if the person is thin, you don't have to give a lot of radiation, because in obese patients you need higher dose, and in thinner patients you need lower dose. That also can be easily adjusted by switching on a particular switch to reduce the dose. So that is another feature which helps reduce the radiation to the patient as well as to the team of a doctor and the entire team present in the cath lab. So that is one thing which I really like about this machine. And apart from that, in patients who have higher creatinine level, serum creatinine, sometimes many patients they have borderline creatinine value or higher creatinine level when there is a insufficiency of the kidneys, renal insufficiency is there. That time what we want is that we want to use the minimum possible contrast. So this machine has a feature of Innova spin or rotational angiography you can call it. So when you have that limitation of impaired renal functions, we use Innova spin on this machine, wherein you can take multiple imaging from multiple angles. With one injection of contrast, the machine rotates and takes pictures from different angles. So you can use minimum contrast and take and get images from all the angles. So that is another beauty of this machine. So we are using all these features and we have really found them very useful. The 3D feature of this cath lab is particularly helpful in patients who require coiling of aneurysms, brain aneurysms, AV malformations. So our neurointerventionist is also very fond of this machine, because this cath lab he is using for doing safer, it helps in doing neurointerventions very safely because of the 3D imaging.